This is one of the very earlier logo of ours. Now, Women Health is in Women's Hand is a mission for March. March is dedicated to empowering women to take charge of their health. This activity we've been doing for a very long time, and this time also, the activity have started from the first of this particular month, and the two centers which we have selected out, I was told this morning, not a single doctor has reached them. Not a single doctor has reached them. So that is the kind of care we take for ourselves, and that's a very sad state of affair. I can say that, because unless we take a charge of health by simple and yet effective strategies, we can combat anemia, we can combat obesity, hypertension, diabetes, osteoporosis, and cancers, ensuring optimal health for every woman in this particular country. As for the International Women's Day this year, 2025, theme is concerned, it is for all women and girls. It's the right, equality, and empowerment. Empowerment is taking charge yourself. How we can take charge of our own health? We can prioritize self-care, which is very, very, very important. Regular checkups, healthy eating, physical activity, and a mental well-being. Yesterday, I was there, Women's Day celebration on a Rajasthan chapter, and the assessment of most of the experts who had been there, senior ones, that not more than the 20% gynecologists have their pap smear and HPV screening done. Very true. Prime Minister has very easily said by 2047, we will have Viksit Bharat. But with 50% of anemia in women, how can we have a Viksit Bharat? Anemia is the single biggest health challenge for Indian women. India affects 50%, I will say to be very exact, 57+% of women and girls are anemic, leading to bad school performance, fatigue, low productivity, low immunity, and a complication in pregnancy and teenage. It is severe anemia, and severe anemia, for everybody to know, is 7 grams is the cutoff, which kills the mother and the baby. We have 50% anemia, 10 to 13% are severe, and 35% have a moderate anemia. This I'm talking about adult women. And as far as the figures of teenage girls are concerned, it is found that 40% of people are either moderately anemic or severely anemic. So the difference is there. With increasing age, we get worse. How can anemia be tackled in Indian women? Daily iron and folic acid supplementation of iron folic acid. If there's a mild anemia, it has to be taken on a daily basis and not less than 200 milligrams per day. It's a topic by itself, how the oral medication of iron to be taken. Injectable iron in moderate anemia is the rule now. The government wants you to do it. Again, we find 30% of the gynecologists give injectable iron, 70% are quiet about it. And the government of India rulings is again, if patient is severely anemic, that is 7 grams %, if you want to really save her, admit this particular patient and give her blood. As for the high protein diet and the iron rich diet is concerned, this is green leafy vegetables, jaggery, dates, nuts, all that kind of things should be taught right in the school so nobody has any confusion. Dr. Gorak has already informed you what we talk about, days, all these kind of things. They are not so iron rich. I'm going to give you a presentation by this Professor Gopalan, who has had been the director of the National Institute of Health in ICMR, to read what is iron-rich diet. Weekly Indian iron folic acid, people have to take it, even if your hemoglobin is 12 grams %. So all the gynecologists who are listening me, इसको आज गांठ बांध के रख लीजिए कि जिन पेशेंट का 13 ग्राम हीमोग्लोबिन है, 12.5 है, सबको आपने वीकली आयरन टैबलेट देनी है. Deworm everybody every 6 months. ये आप ओपीडी में देना शुरू कर दीजिए, 30% एनीमिया उन फैमिलीज में कम हो जाएगा जिनको आप ट्रीट करती हैं. Managing heavy periods by aggressive treatment is important, and you all know that 20% adolescent girls and almost 40% of elder ladies have problem of heavy menstrual period. Why should every woman know her hemoglobin level? Her hemoglobin level, if it is less than 12 gram percent, she is anemic, and this leads to fatigue, poor immunity, pregnancy risk and complications, poor work capacity. Child born to anemic mothers have low IQ. Child school grades are badly affected because the brain requires 20% oxygen, and which is taken care by the hemoglobin. And by this particular process, we are producing a lazy race, जो कि कामचोर है. Now, what is the ideal weight for women? BMI for we Indians and Southeast Asia is 18.5 to 24.9 is for the Westerners, and as far as we are concerned, it is 23 is the upper limit of normal as far as the BMI is concerned. The rule is the waist should be half of the height. Now, the cutoff which has been given by the government of India is 32 for women and 36 for gentlemen. As far as our Indian data is concerned, now this particular data has been has come for people who are adult, 18 years plus, on obesity and making them physically unfit. I'm including overweight and obesity together. If you take overweight and obesity together, 57% women are in this category as compared to 42% men. And this is metros of this country. Again, Pan Bharat Motapa projection is from 1990, they have compared to 2050. And they feel that in 1990, the women were 12% obese, not overweight, obese, and man was 8%. And it is expected by 2050, the obesity, that is BMI more than 27, will be there in 25% of the women and 20% of the men. So you can see all along, the obesity in women is much, much more, especially if they are affluent. Again, obesity has become a big problem in Bharat. In 1990, there were 3 crores. In 2024, there are 35 crores. And 2050, God knows. And it is mainly because of the sedentary lifestyle. आप बैठ जाते हो, पानी भी आप उठ के नहीं ले सकते. So that's why you gain weight from time and again. What is the easiest way to prevent obesity? Plate method. Take a smaller plate. Half of the plate should be filled with vegetables and fruits. 1/4 by protein and 1/4 by millets, whole grains. Follows the Japanese rule, that is, भूख लगे 100 के तो 80 खाना, 80% खाना. And take 10,000 steps a day or a minimum 30 minutes of activity. The biggest cause as far as PM is concerned, which is, I think, all Bharatiya have to concentrate on this, is oil and outside food. Oil सबसे बड़ा दुश्मन है भारतीय लोगों का. Average family of 4 consumes 8 liters of oil in today's date. Every person consumes 2 liters of oil. The tip is that person should consume half of it, 1 liter per month per person. How much in oil to be consumed? WHO says it should be less than 30 grams per day. 1 kg per month per person, one must remember. And how much to be consumed by year per person? It should be 12 kg, but the average today in metros is 20 kg per person per year. How does obesity impact women's health? You all know that obesity is related to polycystic ovarian disease, infertility, diabetes, heart disease, joint pains, and in future, mental health. And that's why 2018, the government of India has started a project which is called Right, Eat Right India. And you find still people who are obese and overweight, they are malnourished. You can find this is much more in women and girls. This is a cause of concern for this country. How much protein to be taken by a woman? Adult at least 1 gram per kg. It means 1 gram per kg. Adolescent should be 1.5 gram per kg. Pregnancy it should be 1.5 gram per kg. If I'm 60 years, 60 kg, then I require 60 grams of proteins. What are the top 5 foods Indian women should eat daily? Nuts and seeds, almonds, a very little of walnut, flax seeds for omega-3 fatty acid. Green leafy vegetables for a good source of iron and calcium. People who don't have inhibitions should take 2 poultry eggs or paneer or tofu for protein. I think people who have no inhibitions should take 2 poultry eggs. This is my suggestion. Dal and legumes are again good source. They have to be taken in variety. 100 gram moong ki dal is equal to 8 white of eggs. This message should be spread by all of you. Dairy or alternatives for bone health are needed. Fruits, vitamin C for immunity and iron absorption is again desirable. Why should women avoid processed foods? Because they give rise to increased risk of diabetes, obesity, heart disease, and cancer, not only to themselves, but to the family as well. How much water they should be taking? 2.5 to 3 liters per day. No cold water, 2 cups of hot water, preferably in the morning. No aerated or fuzzy drinks. Alkaline water is very easy to make. Take a glass bottle of 1 liter. Put खीरे की 2-3 फांके इसमें डालिए और 2 पुदीने की लीव और 2 तुलसी की लीव डालें. It is alkaline water. 1 liter is good enough for you. How can women improve gut health? No outside food. Probiotics like curd, butter, milk, kanji should be consumed. Fiber-rich diet. Avoid trans fat. तला हुआ खाना और खासकर वो वाला जो तेल जो बार बार आपको तलने में आप यूज कर रहे हो, it harms you very, very badly. I think, further discussion will be there on this. Why do women need vitamin B12? To prevent weakness, memory loss, nerve problems, and macrocytic anemia. We all should have a morning routine of ours where we must, when we get up, we must warm up, stretching exercises or yoga, 10 yoga asanas, pranayam at least for 5 minutes morning and evening, meditation 3 minutes, good enough. And if you can oblige your body for 30 minutes walk, it will be great. I suggest you that you please drink 2 glasses of warm water and a 20-minute sunlight exposure to offer vitamin D. Non-communicable diseases are, it is data from the National Institute of Health, ICMR Hyderabad, is that 70% of the deaths in Bharat are caused by non-communicable diseases. And that's why they should wake up. In February, the Ministry of Health has started, and this particular campaign will go on for 3 months. They will go door to door and they will check their weight, BMI, hypertension, and diabetes. And they will also screen for breast and oral cancers. How can we prevent hypertension, especially in women? The National Family Health Survey 5 has shown that 22% of women are hypertensive. They must reduce the salt less than 5 grams per day. Chai ka jo flat wo hai, it will be 5 grams. The people who are hypertensive should take less than that. Daily 30 minutes walk, yoga and pranayam. Check BP once a month. The people who are not hypertensive and learn relaxation exercises. And ye band kar dijiye, anybody who is just mute yourself. And we must adopt a policy G or G no de. हम लोग जो unnecessarily worried होते हैं वो वाली habit हमें छोड़नी चाहिए. What are the symptoms of high blood pressure? No symptoms at all in the beginning. Headache, dizziness, breathlessness, chest pain, and blurred vision. Many of you, in spite of you being doctors, probably may not be knowing it. I'm just reminding it again. Normal is systolic less than 120 and diastolic less than 80. We call it elevated. Whenever you find it is 120 to 129 systolic, and as for the diastolic is concerned, again it is less than 80. तो आपको सिस्टोलिक में भी जरा सा भी बढ़ जाए तो उसको बोलने पड़ेगा elevated blood pressure, and it must be documented. Hypertension stage 1 is 130 to 139 your systolic blood pressure, and 80 to 89 your diastolic blood pressure. High blood pressure hypertension stage 2 is 140 or higher or 90 or higher. Hypertensive crisis is whenever you find your systolic blood pressure is 180 or more and the diastolic is 120 or more. It is crisis and you require emergency treatment. The menace of diabetes and pre-diabetes in our country is 16% are pre-diabetes and 11 to 12% have diabetes. I'm talking of a woman. And if there's a family history, it is much, much more. How can Indian women control diabetes naturally with minimum medications? Become conscious of your weight. Aim BMI 19 to 23. In spite of me, what I was 15 years back and what I'm today, there's a difference of almost 12 kg and still my BMI is 24. So I'm trying very hard to come down to 23. Avoid sugar and refined carbs. Patronize millets, motanas. Oil should be 1 kg per month, 1 liter per month per person. Increase fiber intake, which is whole grains, vegetables, and nuts, 25 grams per day. Daily exercise and have a great sleep of 8 hours. And I feel the people who complain that their diabetes is never controlled, they should start using continuous glucose monitoring. That will do them good. It's a wonderful machine. And now it is available for all of you for 3 months. It is there and it will cost only 5,000 rupees. Now we all know that bone health, we have to start acting right in our adolescent period, because 1 in 2 women in our country are osteoporotic or osteopenic, while in comparison to 1 in 5 as far as the men folk are concerned. And as you all know, that as the osteoporosis will set in, our height will decrease because of the collapsing vertebrae. And this is a busy slide to show to you that we can prevent it by taking no alcohol, physical activity, become obsessed about the weight, taking calcium and vitamin D supplementation, and exposing ourselves to 15 minutes sunlight. The risk factors are rheumatoid arthritis, dietary factors, caffeine. Caffeine we are very fond of, गर्मियां हो सर्दियां हो खाना खाने के बाद चाय चाहिए. So I think all good which you have taken in the food is nullified. Our sedentary lifestyle is again very bad. Steroids, genetic factor, thyroid problem, woman more than 65, tobacco use. All these are risk factors as far as osteoporosis is concerned. How can women improve bone health? Calcium-rich diet, milk, curd, paneer, daily sunlight, strength exercise, walking and weight training. और मेरे जैसे लोगों को बताया गया कि 1 grain of rice आप कर्ड में ले लीजिए 90 days के लिए, आपकी कैल्शियम काफी हद तक ठीक हो जाएगी. Make them conscious about calcium-rich food right in the school. Preventive DEXA must be done by all women, whether they're doctors, whether they're nurses, whether they're homemakers. It will do you good. I will take one class just on this, why preventive DEXA can be very useful for the society. Pregnancy, we should take 1 gram daily. Lactation, 6 months, 1 gram daily, we must take it. And there we falter quite a bit. 6 months dose, it has to be taken. And majority of the people don't take it. Become conscious of vitamin D deficiency. And these are on the right-hand side. These are the calcium-rich food which you make your bones strong. Now, as for the cancer awareness पे चर्चा की बात है, breast and cervix, we all know that how can we prevent breast cancer? हम लोगों को right in the school and the college we must know what is our lifetime risk of developing cancer. What is the lifetime risk of every girl should know. Relation of family history and breast cancer they should also know. Health, lifestyle, healthy weight, healthy soch is also important to prevent cancer. Healthy nutrition, no food from outside, and the trans fat are killers. Monthly self-examination, though scientifically monthly breast self-examination has been given up, but I think as far as our country is concerned, this should be taught to each and everybody. At least we become conscious about our breast swellings. Clinical breast checkup every year should be done as a part of the yearly medical checkup, and mammogram after 40 years. People who are high risk as of the family history is concerned, and 50 years, people who do not have family history of breast cancer. How can cervical cancer be prevented? I think all gynecologists have to be obsessed about 90-70-90 mission for HPV vaccination should be taken for 26 years, till up to 26 years, and no girl between 9 to 14 years should be left out. Elders can decide for themselves if they value, then they can take HPV vaccination. Yearly medical checkup is must. Pap smear every 3 years and 30 years thereafter, and regularly thereafter. Why I'm talking about pap smear and not talking about VI and Willy? Because मेरे जैसे लोगों को इतने सालों से बोलते 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 अभी भी 1% में भी असर नहीं आया. So I've given up myself. Teenage girls teenage girls' health is not a priority in Indian family. How can periods be pain-free and the problem-free? Make them conscious about the normal periods pain, menstrual hygiene, when to consult a doctor as far as the periods are concerned. Regular exercise, good hydration, warm compresses, clean pads. Check for PCOS if the periods are irregular and delayed. Check for endometriosis if dysmenorrhea is significant. Mental health, stress, worry, sadness is all around. And we should not forget there's a gender-based violence and there's a domestic violence. 1 in 3 women is affected by this. Why the mental health is important for women? Because women compare themselves. उनके पास एक बीमारी है, compare. And that's why they have a depression, 15% gross, and anxiety is there in again 25 to 30%. Stress affects hormones, it affects heart health, it affects immunity very badly. What are the simple ways to reduce stress? Do not compare. Deep breathing, yoga, 8 hours good sleep, good hobbies, social connections, digital detox. कहते हैं जब आप दूसरों की सेवा में अपना टाइम निकालना शुरू करते हैं, God comes forward and takes care of your health. Stay active. What is the best way to stay active daily? Climb stairs, 15 minutes climbing is equal to 1 hour walking. Walk for 30 minutes. Walk after meals. Stretch every hour. Surya Namaskar, Cobra Asana. Pranayam mein, I'm very fond of Swaiso, which I can love to teach all of you. Lom Vilom and Brahmari Pranayam. And किसी ने सवाल किया कि जो ट्रांसजेंडर है उनको बीमारी क्यों नहीं होती? It's because of the art of clapping they've learned, and each one of us should know how grateful we can be if we develop this art of clapping. Again, I can teach. How can women get good sleep? Avoid screen 1 hour before bed. Follow a bedtime routine for herself and children all the days in a week. And चिंता छोड़नी पड़ेगी, तभी नींद आएगी. चिंता कंपेयर करने की अपने आप को दूसरों से. What is first rule for a healthy heart in woman? 30 minutes of brisk walking, climbing stairs, yoga daily, pranayam daily. And each one of you should keep this emergency kit right in your bedroom. Drawer. Mini aspirin 152 tablets for decreasing blood clotting. Clot busters are Clopidogrel 75 milligram 4 tablets. Atorvastatin 40 milligram इनको सबको बांध के रख लीजिए, और जो भी लोग आपके स्टाफ है उनको सबको दीजिए कि आपको इमरजेंसी के लिए रखना है. एंड this should be your best Deepavali and holy gift to each and everybody. Preventive care access, it is totally missing in our country. मैं फिर बताना चाह रही हूँ, we have been advertising for the last 10 days on the health, but two big organizations where we have very much subsidized rates, not a single person has gone till today. As far as the NCDs are concerned, there's a lack of access to regular screening for hypertension, diabetes and cancer. तो मिनिस्टर ने डिसाइड किया कि सबके घर ही जाके ये देख लेंगे. What a must as for the health checkups for women is concerned. CBC, along with peripheral blood smear, electrophoresis to exclude thalassemia. Blood sugar should be always 120 and less. HbA1c 5.7 is pre-diabetes and 6 is diabetes. Cholesterol and lipid profile must be done annually. Thyroid should be done at least once in a year. Minimum. Bone density test at 40 is must, and after menopause regularly. Mammography if you are low risk person 50 years, and theory thereafter. How can we reduce belly fat? We should be conscious about our waist should be half of our height, and there should be dedicated exercise, become conscious of oily food, strength training and protein rich diet, low carb diet, no late nights eating and junk food. Big no. How can an Indian woman maintain hormone balance? Manage stress, eat healthy fats. मैं कहूँगी 5 बादाम सुबह और 5 बादाम शाम को लेना चाहिए. Stay active, sleep well. What is the motto of every Indian woman should be? My health is my power and I take its charge. I repeat again, woman health is in a woman's hand. These are the 10 simple 10-step formula for winning the battle against anemia, obesity, hypertension and diabetes. Weekly iron and folic acid supplementation for anemia prevention. Even if your hemoglobin is less than 12 grams%, it has to be daily iron folic acid and deworm twice a year. 10,000 steps a day for weight and healthy heart. 10 minutes yoga, 10 minutes pranayama morning, evening, clapping mantra, weight bearing exercises. Salt should be less than 5 grams to control your blood pressure. Low sugar, low carb, high fiber diet for all people who are listening to me who are more than 60 years. Adequate protein for your age, 20 minutes of sun, plus calcium rich diet for strong bones. Regular screening for anemia, blood pressure, diabetes and cancer. Yearly health checkup. If you're more than 50 years, this checkup should be twice a year. Stress management, have a quality sleep, and digital detox should be there at least 1 hour prior to sleep. March is the month of women's health. This March, let's make health a non-negotiable priority. Your health and your spouse's health. A healthy woman means a healthy family and a healthy India. Educational achievement, as far as our country is concerned, we are satisfactory progress. But as for the economic participation is concerned, women labor force is low, quite low. So the people who are in contact with us, we should treat to as that we empower them, and so they are economically independent. Thank you very much.